Thank you for coming today and welcome to our presentation about depression. Depression is a very common condition. You don't have to be an Olympian or a famous writer to develop depression. It is now the number one cause of illness or disability around the world. The World Health Organization estimated that around 300 million people are suffering from depression around the world. So, what does depression feels like? Depression, first and foremost, is a feeling. For those who have not experienced what depression feels like, just imagine the first time when you had an intense feeling, such as when you were madly in love or when you're going on a first date. As far as I can remember, I struggled to sleep, my appetite was off, thinking clearly was difficult, I was overwhelmed, and people thought I was going crazy, but I was happy. Now, depression is opposite of this, and it's like a black cloud that slowly creeps in. One feels sad, and the sadness won't go away. You might lose confidence, feel guilty for no reason. You might lose interest on things that you used to enjoy. Everything takes a lot of effort, and sadly, some may even experience thoughts of suicide. So, what causes depression? Depression is associated with one or combination of different factors. You may inherit the risk of developing depression through your dad or mom's genes. Living in a chaotic and unstable environment can also affect your mood. It is now known that physical illnesses such as pain or thyroid problems can cause depression. We also tend to overlook that medications itself can have mood changes as a side effect. Sometimes lack of sleep, poor diet, and lack of exercise can make our body and mind worse. Events such as trauma and abuse and bereavement can have a lasting impact on our health. Social situations such as problems with families and friends can trigger depression. Substances such as alcohol or drugs are used by some people to help with depression, but they are known to cause depression themselves. No man is an island, and isolation is a big risk factor. There are a lot of other causes of depression, such as death and financial difficulties, but sometimes depression can come for no reason at all. So, how do we manage depression? There are things that we can change, and there are things that we have to accept. We can't choose our parents, obviously, nor our genes, so we just have to accept it as it is. But we can do something with our environment. Even just a change of light can make you feel better. Now, keep yourself healthy by participating in vaccination and screening program and having routine blood tests to identify any thyroid problems, among others. Take your medication as prescribed and discuss alternative options with your doctor if it is the one causing the depression. There is also no substitute for good sleep, diet, and exercise. Sometimes we also need guidance, and it may help if we talk confidentially with a professional about the trauma in our life. There is also little to lose if you try to improve your social situation and getting involved in positive social groups. Avoiding alcohol and drugs should be one of your priority. It is likely that your depression will not go if you continue to abuse your body. Try to make friends and be friendly to yourself too. And there are hosts of other helpful and positive things to do. When you've done all of this, then you can truly say no to depression. We never said it's going to be easy, but help is available. Never forget about your doctors and therapists, your friends and family. Find support groups that can help you. If you are suicidal in the UK, you can ring the Samaritans or go to Accident and Emergency Department. There are also tons of information available at different websites. Just remember, time heals all wounds. So now we've come to the end of our presentation. Please subscribe and share it with your friends and help me develop more videos. You may also download this PowerPoint presentation at www.bestreview.com. Please remember, however, that this presentation is not a substitute for medical advice and created mainly for PowerPoint presentation. Thank you very much.